request the head of this hospital, Richard Siampi, you must hear him. He's done a wonderful job here.
Yes.
And the minister is very impressed. So before I ask the minister to speak, you must hear his voice. He's our host, please.
Thank you very much, Waziri Duale, and His Excellency the Governor of Kisumu County, the DG Health, the PS Health, and also my colleagues, CC Health from Kisumu County. Mine is just to welcome all of you to Jaramogi Oginga Odinga Teaching and Referral Hospital, and we will continue providing excellent clinical outcomes in healthcare. Thank you very much.
Thank you. Now it's my time to ask Waziri to address you, but before he speaks, I have known Honorable Duale for a long time. He's a man who does what he says. He's a man of principle and of action. And since he entered the Ministry of Health, where I was before myself in the coalition government, I have seen the things he has done. He has his feet on the ground. He moves from one country to the other to see what is happening. And today, as we have been going around, I must thank him for the promises he has made for Kisumu County that I leave him to say himself.
Thank you. His Excellency the Governor Anyang' Nyong'o, Mheshimiwa, and the whole leadership of the both county and the national government health sector. Yes, he has not said that being very principled, doing what I'm supposed to do. I learned from him 20 years ago when I became a member of parliament, and he was a minister for medical service. So all that I'm doing is part of the old leadership that I have a lot of respect for in our country. And number one, we are in Kisumu County for a number of reasons. To look at the health sector, health is devolved. We work very well with the Council of Governors, including Professor Anyang' Nyong'o. So we came to look at all that, but more so we came for the rollout of the Social Health Authority and working together with the Digital Health Agency. And I'm with my PS, Oluga, and the Director of Medical Service, Dr. Amoth, the CEO of SHA, you know, Mercy, Dr. Mercy, and Anthony, the CEO of DHA. First, I want to thank the leadership of Professor and his CEC for Health, because Kisumu County has registered so far close to 600,000 people. Again, it's a target of 1.1 million, and has made Kisumu County to be number 5 of the 47 counties. Number 1 is Mombasa, number 2 is Bomet, number 3 is Nyeri, then there's Elgeyo Marakwet, and there's Kirinyaga, then there's Elgeyo Marakwet, then there's Kisumu. 2, I think we have also come to train his healthcare workers, and 39 of his public health facilities have already been digitized end to end. Patients go through the system until a claim is made to SHA. We have also come to visit this very important Jaramogi Oginga Odinga Teaching and Referral Hospital, which he graciously handed over to the national government. So it's one of our referral hospitals under the Ministry of Health. And I want to assure you that under the able leadership of the current CEO, Dr. Siampi, and this man has a track record. He used to be the CEO of Kenyatta National Hospital, so we know him. And Professor Anyang' Nyong'o knows him when he was the Minister for Finance. We are going to transform this as a regional referral center with all the equipment. Today we have, commissioned the latest modern CT scan. We have commissioned the mammograph. All the other required facilities are here. We are only going to give him all the resources, and I want to assure that we complete the regional cancer center. That I have taken it so that our people in Kisumu County and the whole of the Lake Region counties, which are about, I think, 14 counties, can access this regional cancer center. Apart from saying all this, let me also say this for the avoidance of doubt. We have introduced, both within the Social Health Authority and through the Digital Health Transformation Digital Superhighway, something called Bed Capacity Access Rule. We will not allow a Kenyan to sleep on the floor again, whether it is public, private, and faith-based. We will not. Because the leadership and the leadership of this country, including myself and Mheshimiwa and Professor Anyang' Nyong'o and everybody, they don't want their relatives to sleep on the floor. So they must also not allow the citizens and their voters not to sleep on the floor. Unlike NHIF, because of corruption, people used to claim reimbursement from NHIF. Those who sleep on the floor, the 3 who sleep on one bed, 3 mothers, pregnant, who don't know each other, that story has come to an end. You can say anything, and I have said it. If you want more patients, go buy beds. If you have bought beds and there's no space, build the maternity and the wards. There's no question about it. There are many people talking about. And I have closed over 1,000 facilities. And in the next 1 month, I will close another 1,000 facilities. Our teams, regulators. If your facility is level 2, you will stay at level 2. If you want to move to level 3A or 3B, you must upgrade your facility. You cannot claim to do more surgeries than Kenyatta Hospital or Jaramogi Oginga Odinga, and you have a small room somewhere calling itself a health facility. So you either provide quality care, health care to the citizens, or you close those facilities. And I want the citizens, when you go to primary health care facilities, level 2 to level 4, dispensary, health center, it is free of charge. You walk in, you see a medic, you go to lab, you go to pharmacy, you go home, as long as you are registered with Social Health Authority at the primary health care. And Professor knows, our CECs, they know. If you come to a tertiary institution like this, level 5, level 6, part of level 4, you must register and pay the annual premium. If you can't pay the annual premium, go to Lipa Sha Pole Pole. And every day, including last night, over 10,000 Kenyans have paid from the informal sector. 1.8 million Kenyans in the informal sector, including Mama Mboga, has paid for SHA premium, annual premium. We had last night 2,000 Kenyans who went through SHA, Lipa, Pole Pole and have paid. So it's working. The people who are complaining are those who have ghost facilities. There will be no ghost facilities. There will be no corruption in healthcare anymore. And there will be no ghost doctors. Now, next week, so what I tell you, Mukhtasari, kabla ya full bulletin. Next week, we are introducing into our system the drugs code, medicine code. You cannot dispense, number 1, pharmaceutical products if you are not a pharmacist. Number 2, you will not dispense fake drugs. The drugs that Kenyans will get must be drugs that are approved by the Pharmacy and Poison Board. So there will be also another noise next week. And that noise, I'm ready for it. Si Michuki amesema wakati alikuwa minister, the late Michuki alisema watu matatu watu wakae. Hakuna kusimama. Sasa kama hiyo iliwezekana, mambo ya watu wa Kenya kulala chini kwa floor ya hospitali, hiyo story. Na mkichajiwa kwa primary health care, if you are charged, co-charged, please dial our call center 147. Sema hiyo facility inafanya ukora, iko na kitanda 10 lakini wamelalisha watu chini. Hiyo simu hata ukipiga haitalia dakika sekunde moja. Na ukikata tutakupigia. Tunakuuliza mbona umetupigia? Sawa sawa? So let's clap for Kisumu County. They are doing very well. And I am very happy with the leadership of Professor Nyang' Nyong'o and his whole healthcare team, because he is a very progressive governor, and healthcare and education are two very important to our administration. Primary healthcare is paid by the government of President William Ruto. It is free. Don't allow to pay coffee. Hata kitabu ya exercise usiambie ununue. Ingia hospitali, utibiwe, utoke.
We have received reports of 4 deaths in various parts of in Migidani. Not correlated, nobody is exhibiting any unusual symptoms. We have not established any clear pattern. Our team is on the ground, led by the Chief Government Pathologist, Dr. Johansen Odror. As soon as we receive reports, we shall be able to share with you. No cause for alarm now, because some of the cases are reported to have had coexisting conditions, and they had been in contact with the health facilities. So we are strongly of the opinion that there's nothing to worry about. Nobody in Mombasa is exhibiting any unusual symptoms, and wananchi should stay easy until we come up with a report based on the findings of the postmortem team.
Last one. Yes. It's okay? Yeah. Okay, thank you very much.
And I think just to finish, all the tests samples have been sent to our Kemri labs in Kilifi, and we will tell the country what's going on. But what the DG has said as our head of technical, not only for me, but for the whole country, matters health is him.
Good. Husky today. I am told that it is not so bad. Sometimes people want when the voice is breaking a bit. And we are very glad to be here in the Jaramogi Oginga Odinga Teaching and Referral Hospital. First of all is to thank His Excellency the President, because this hospital has been elevated to a level 6 facility. Level 6 facility means that it is at the status of Kenyatta National Hospital. It is one of those our national referral hospitals now under the management of the Ministry of Health, and specifically under the State Department for Medical Services. And we are very glad, first of all, that this facility, having been elevated to a level 6 facility, is now going to open opportunities for this region. All the way for the 14 Lake regional blocks. We have had a big challenge with the congestion in Moi Teaching and Referral Hospital. We get there almost 150 cancer patients every day that are lining up for radiotherapy. Now we have come here to inspect it. I was here early. In fact, this was my first assignment when I was appointed. I came here on a Saturday. And today we've also come with the Cabinet Secretary who is leading the process for digitalization and also the process for Social Health Authority activation, what we call Taifa Care activation. And visiting this facility is extremely symbolic, because it is the transition between the county government and the national government. And this is the cooperation and the partnership that we all want as far as health service delivery is concerned. So we are here. We've just launched a new CT scan, 128 slides, which is the latest CT scan. And we have also launched a mammography. We are doing this through what we call the National Equipment Support Program. All of these things, including the cancer center that we have a program to accomplish so that we can have a LINAC or a radiotherapy machine here, are meant to achieve one thing. They are meant to ensure that the health system performs. The health system performs. What does that mean? That the Social Health Authority that we are activating and encouraging people to join, to register, to pay up for, when they come to a hospital, that service is there. We've had a few challenges sometimes where the Social Health Authority has a package, but when people go to the hospitals, they don't get that service. And then people start to say, SHA is not working. But it's the hospital that does not have the service. It's like you have money, you are going to a hotel, but the hotel doesn't have the food. So you go back with your money. And so when we establish the social health authority, when we make citizens join the social health authority, when they pay up, it is also important that we are investing in hospitals such as this to make sure that the services are available. And so that is the foundation of why we are here. And especially because after 18th of June 2025, when the hospital was gazetted as a parastatal under the Ministry of Health, we are now in the process of a transition that will take 6 months. Within that process of transition, we will make sure that we transition all the staff, we transition all the assets, we transition all the operations, we appoint a new board, and more importantly, that we improve the services here to a level 6 status. Level 6 status means specialized services. And I've just talked about the cancer. We are also going to establish a sickle cell center of excellence here, which is going to be one of the only sickle cell centers of excellence in Africa. And recently you saw the president in the United Kingdom. I was there with him when we were meeting the 14 universities, and part of the collaboration with the King's College London will be to establish a center of excellence for sickle cell here. So that is very important, so that wananchi know that services must be available. But what is more important is that wananchi do not go into poverty when they are seeking those services. What makes you not go into poverty is when you register with the Social Health Authority. And that is why we are here, to activate and to roll out. Okay? And so we have a whole program. Our Taifa Care package has 4 components. Component 1 is the insurance component, or what we call the health financing component. That is where we are telling people, ingia SHA. Ingia SHA. How do you get in there? You dial *147#. You follow the instructions. You go to Huduma Center. You go to any health facility that is next to you. You go to a community health promoter. Those are 4 ways that you can use. A community health promoter is in every village. Every 100 households, there is 1 community health promoter. In this region, we call them Nyamrerwa. Okay? So these are people who can register you. You go to any Huduma Center, you can be registered. You go to any health facility, you can be registered. You sit at home and just use your phone and dial *147, you are registered. So the mechanisms are so many, and we are very proud that here in Kisumu County, we already have 52% of the population registered. But registration gives you advantage to access 2 things: to access the primary health care fund and to access the emergency, chronic and critical illness fund. It gives you the permission to access what we call tax funded. But there are some other services, like those that will be offered here at Jaramogi Oginga Odinga, those that are offered in level 4, some that are inpatient, when you want to be admitted. When you want to be admitted, some procedures that are paid for, 200,000, 300,000, the things that make people go to poverty. The things that make people go to poverty, those ones you have to now pay for it. You pay for it through what we call the Social Health Insurance Fund. If you are employed, the employer deducts 2.75%. If you are not employed, you go through what we call a means testing. Means testing is a mechanism that is scientific, that just shows your economic status. Kama we ni mtu wa kuuza banana, it shows mtu wa kuuza banana anafaa alipe kiasi hii. Mtu wa kuuza machungwa kiasi ingine. Somebody else who does boda something else. So it is because we are all not equal. So it is very, very important that all of us understand that you have to pay for the Social Health Insurance Fund. So those makes 3 things. The primary health care fund, which is appropriated by Parliament. The emergency, chronic, critical illness fund, Parliament. Now we have 8 billion for emergency fund, and we have 13 billion given to all Kenyans. So if you have not registered, you are the one doing yourself a disservice, because you are supposed to access services for free, paid for by government, but you have denied yourself that opportunity. And we really want to work with the media. Please tell our people to register, because services in level 2, level 3, are all free, and level 4 in public hospitals at the outpatient, they are all free. They are already paid for by government. The president has announced this, the cabinet secretary has announced, and we are appealing to the fourth estate, to everyone, to tell wananchi this just by registration. But when you are admitted, when you want to go for surgery, please also go the next step. We are having 2 models in our Taifa Care. One is contributory, where you pay a little bit, and the tax fund, where the government meets you in the middle. So the government has already met you in the middle, 21 billion shillings. But then we also have to get a bit of contributions, because it may not be enough. Dialysis alone costs 7 billion shillings. Treatment of diabetes alone costs 48 billion shillings. If you look at all the diseases, it's around 550 billion. So we are saying, let's go halfway, come halfway, let's all not go into poverty. So this is our Arambe model, to make sure every citizen has the insurance, so that is the first component. The second component is to make sure that all hospitals are digital. Digital helps us to make the patient record be movable from one place to another, so that if you come for a CT scan in Kisumu and tomorrow you are referred to Nairobi, we want you to save money, and we want you to save us money. So you don't have to repeat the CT scan, because we can see that record. That is also why we are here. So today we are here to distribute over 1,000 tablets for Kisumu County, for all the hospitals that are public, so that every single hospital has a tablet, has a computer. In that tablet there is a system. That system enables the patient to register, enables the patient to be seen, enables the patient to have their record, and enables the Social Health Authority to pay the facility through the claims. And so we want to make sure that all public facilities are digital, are paperless. And this is to help all our patients, so that you are not defrauded, so that we can see that you are seen in Lumumba Health Center, the doctor gave you this medicine, you did not get well, that is why you got to another facility. We can even follow up and say, why were you not given quality of care? Why did you get sick again? Was your disease so advanced, or was it that you were mistreated in the facility? So digitization is very important. It's important for SHA, it's important for the patient, it's important for the facility. The third is the health workforce. The doctors, the nurses, the people who treat us, the community health promoters. We are making sure that all of them are as well as the healthcare system. That is why you have seen we are sorting out the issues of UHC. You no longer see the noise. We have sorted out that. The verification is going on. You have seen some of the things that are coming out. We are supporting our community health promoters together with the county governments. We have sorted out the internships. We have sorted out the doctors' arrears. We have sorted out the nurses in terms of, you saw they wanted to go on strike. Now it's all good. We have sorted out the clinical officers. We want to make sure that our health workforce have only one mindset. They are focused on treating the patients. And I know this because I am from this background. And we are making sure that we encourage all our health workforce to have only one mindset. That's why we are sorting all their problems. And you have just seen in the last 3 months how quiet now the sector is on that. And we want to thank all our healthcare workers. But we want you to do one more thing for us. You must treat the patients the way the patients are required to be treated. The patient is going to be the boss of the healthcare system. And that means that you as the worker must give the patient what belongs to the patient, which is what? Which is competent service, which is compassionate service, which is the care that they require. They come to hospitals when they have pain, so we don't want any other pain to them. The last bit is on commodities, to make sure that dawa iko hospitali. On the commodities, we are reforming KEMSA. You have seen the order fill rate has now improved from 44% to 51%. We want to take it to 90%. We are making sure that facilities have money directly. Yesterday, I was with some facilities in Busia. Even if you go to the facility that we now have here in Yalenda, where we work, at the railways, facilities are getting money directly. 500,000, 1 million every month. This money is meant to make sure that the mother who has come to deliver has hot water, has food, has medicines. And most of our facilities now can buy that medicine. So how do they buy that medicine? Through the system, again, we have linked them to KEMSA so that they can order directly. We can see that this patient was treated and the patient got medicine. If you claimed the money and you did not prescribe the medicine, we can also see that you claimed money but the patient did not go home with medicine. So that hii maneno ya hakuna dawa hospitali tunataka iishe. So we are very happy to inform the public of some of these reforms. And for this region specifically, adwa wacho gidholuo. Adwa wacho ni kawuono wan Kisumu kae. Wan Kisumu kae nikeche wadwaro ni mondo jite odonje mpango ma Social Health Authority. Wan kae mondo waket computer gi tablet hospital te mondo system mar hospital oti. Wan kae mondo ji oyud thieth maber. Emomiyo wang'iyo thieth kaka timre osiptende wagi mondo wang'i ni dakteche gi nurses bende tiyo maber. To moloyo ni in kaka japiny kidhi hospital to in gi yo minyalo chudogo. To yo minyalo chudogo no ok en yo mamari. En yo ma isedhi ma i-register idonje isha mondo ochulni bill. Koro mae momiyo wan kaka kawuono kendo wadhi e pap kawuono kendo jowa bodong kae mondo gineno osiptande te nigi computer nigi gadgets mondo gineni jopiny te oyudo thieth kaka dwarre. Erouru kamano.
Yes.
I think we can there will be a media. There will be media in
there.
the...
Is a little bit different from this. It's about the immunization process that just ended.
Yes.
How are the numbers? And then
the numbers are looking so good. The numbers are looking so good. We were targeting 20 million children for the typhoid vaccine. We already have 16 million. Just 2 days ago, we had 14. The other day and yesterday, you saw long lines of mothers, and we want to thank them so much. We are now getting to 80% of vaccination across all the counties. In this region, Siaya, Kisumu, Busia, Siaya I think is at 83%, Kisumu is at 81%, Busia is getting there around 79%, and we have extended this up to Friday so that all mothers can get vaccination. We are doing 2 forms of vaccination, the typhoid conjugate vaccine, measles and rubella. And we want to thank our community health promoters. We want to thank all our county governments. We are doing extremely well. Don't listen to anything that is a naysayer. Let me tell you one thing. Everything is very important. Everything is extremely important until the day you are sick. Then you realize that the only thing that was ever important was your health. Everything is very important. You can go on Twitter, you can talk about anything, politics, who you love, all these things. Life, business, anything, your money. Until the day you are sick, then you realize that the only thing that was ever important is your health. So don't allow yourself to be misinformed about your health. Don't allow yourself to have a barrier towards good health. Vaccination is the surest way to prevent diseases. Thank you.
Katibu, how do the numbers look like for the share registration? Because the other day in Omabay, the president said up to 23 million are registered. So far, how?
This thing is a daily thing, so it changes. So when the president says 23 million, every day there is 50,000 Kenyans joining SHA. So as of today, we have 24,800,000, I think maybe getting to 900,000. And the numbers change every single day. Every single day people are joining. And we want to thank Kenyans so much. And that is why we are also here to roll out to make sure everyone is in. One of the principles is equity. We don't want to leave anyone behind. So usijikate nyuma, tafadhali ingia. Asanteni sana.
How are you dealing with the USAID exit?
There will be a bigger press conference where I stated. Thank you so much.
Okay.
Short mine is to welcome Waziri into Kisumu Central, Kisumu County. I'm here for 2 reasons. One, as a member of the Health Committee of the National Assembly. I'm also here as a champion of Jaramogi Oginga Odinga, one of the people who wanted to see Jaramogi Odinga
excel to national level. So today we are privileged. We've walked around, we've seen how digital health agency works, and it works. We've seen how SHA works, and it works. And the good news is that Kisumu County is number 5 in the registration of SHA nationally. So we are doing pretty well. As the houses of media, you have a role to play in encouraging people to register for SHA, as we are playing our part as members of parliament, as we are playing our part as members of the health committee, and as citizens of this country. Waziri has got brilliant ideas for SHA, and we've seen, since he came in, we've seen changes. We've seen SHA moving from one stage to another, and we hope just for better things to work. Thank you.
Okay.